lost a tooth, now what? Endodontics has been about saving teeth.
Yeah.
But obviously, you can sometimes lose teeth due to various reasons, fractures, trauma, too much decay. And look at that, historically, people have been using bridges at the Egyptian times, using gold foil.
And even donor teeth.
Donor teeth.
We talked about that previously.
Yeah.
If you were wealthy enough as a Roman, you could have one forged possibly out of metal. Obviously, we've moved all the way to implants.
Yeah.
And as things are looking, the future talks about replacing a lost tooth with a dental implant that more mimics a tooth.
Yeah, basically a form of regeneration from the tooth bud, which makes a ton of sense. Ultimately, if we can figure out organogenesis mechanisms for developing natural teeth, all you need to do is to develop and basically implant the necessary growth factors or some pluripotent cells, some stem cells that would then develop into a natural tooth. And there are people that are obviously working on that. In the meantime, we're left with the traditional, implant, bridge, or a partial denture for replacement of missing teeth. But more importantly, how can we avoid missing teeth?
I think obviously root canal therapy has been at the forefront of trying to maintain the status of someone with their teeth. But one of the things that we were talking about more recently was the fact that it's from a historical perspective. If we look back over 50 or 60 years ago, when the silver cone generation of dentists and endodontists really became a specialty in 1964.
Right.
And based on that, those people who were limiting their practice, the majority of the people at that time were using silver cones. As an example, the chair of the department here at the University of Maryland was using silver cones, and I happened to be trained by Lou Grossman.
Mm-hmm.
Lou was introducing the concept of gutta percha in the mid-'60s. So we go from an historical approach, going all the way back to silver cones and hand instruments, through to the point of using those same hand instruments, creating O2 tapers, and the potential for filling them with gutta percha and various different sealers. We've then had the introduction of rotary, mechanical-driven instruments, and we've moved through various different obturation concepts, and more recently we've had the opportunity to start to look at hydraulic condensation as an alternative to some of the previous concepts.
Yeah, it's funny. It seems like we made a full circle in endodontics when we were talking about innovation earlier on. And what you mentioned about silver points being relatively conservative in terms of preparation, it kind of shows that fractures of roots were not so commonplace with silver points because of the minimally invasive type of preparation that was involved. I think as we moved on to thermoplastic obturation techniques, we ended up just, for the sake of obturation, removing way too much tooth structure coronally so that we could accommodate either our thermoplastic carriers or our pluggers or spreaders down to the apical area of the root. We weakened roots and we ended up getting cracks as a result of that.
We made it easier for the dentists in terms of some of the techniques, but we also compromised the patient's longevity for that tooth.
Sure.
In terms of how long that tooth was going to last. And unfortunately, in today's world, sometimes I hear from another practitioner, maybe an oral surgeon or a periodontist, that a endodontically treated tooth is nothing more than a placeholder for an implant. Well, that's right. I get set off ready to go up into orbit.
I know.
Because I'm saying if the tooth is treated correctly, it can last the patient's lifetime. So, I think we really have to look at some of this this history here. It really brings us home that things change.
Yeah.
And there is a historical perspective that we need to apply to what we're doing today to make sure that what we're doing is actually beneficial to the patients.
Without a doubt. And, that's the big picture to keep in mind. Obviously, at all time, our goal as endodontists is to save teeth. And the that we can do that best and be most effective at it when we have good foundation principles for saving teeth that